Assalamu alaikum dear audience. You are listening to the discussion aisle and I'm your host Sohaib bin Noor, only on Plant FM 87.6. And dear audience, as always, we've been joined by a special guest, and today we are going to discuss a very special topic and indeed a unique one, that is World Breastfeeding Week, which has been marked all over the world. And why do we observe this day? We're going to ask about the experts today we are sitting with, and we've been joined by Dr. Kubra Mehmood, and she is PhD in Applied Biosciences. And besides that, we have Dr. Aftab Ahmad, his PhD in Regenerative Medicine. We are going to have these two medical experts, their opinions, their insights, and of course, we are going to have their dynamic views on why do we mark this day and what is the importance of World Breastfeeding and why it is essential for mothers to keep doing this, and even what are the myths, what are the benefits, what are the tips, and even if you don't do that, what are the harmful situations that you're going to deal with, God forbid. And coming to you, Dr. Aftab Ahmad, first of all, why do we mark this day?
This is, according to UNESCO and the United Nations, many day are marked all over the year. Like we observe the World Hepatitis Day, World AIDS Day, World Diabetes Day. Similarly, we also observe some weeks and months and even the years, and now we even observe the decade. So it's like the observation of days, weeks, months, and year and decade, and they actually highlight the importance of that day. Just like if we talk about diabetes on one side, so what is the prevalence of diabetes in the world? So we discuss all the issues related to diabetes. Similarly, the main player for this World Breastfeeding Week is the World Health Organization. They mark this week, whole week actually, to highlight the importance, why we should go for breastfeeding, why it's so much important for the babies, and also why it's so much important for the mothers. So it's not only important for the babies but also important for the mothers. So there are like so many health risks for the newborn babies. They can suffer from infectious diseases, they can suffer with many other ailments. Malnutrition is another challenge. So if we go for like breastfeeding, we can better tackle these issues because they're so rich in nutrients and so rich with all the important like things, hormones, enzymes, vitamins, and antibodies. So all the things are there. So in order to like safeguard the babies, we should go to observe these days, and this is like observed by all the health organizations, especially the academies for pediatrics. All over the world they celebrate this day. The nurses organization, they do celebrate, and especially it's important for the developing countries like Pakistan, because if we talk about the health scenario, it's not that very good in Pakistan. If we talk about the health index, Pakistan stands after 150 countries, so that's really a challenge. So if we go for like breastfeeding in Pakistan, we can tackle many of the health issues of the newborn. So that's why it's like in Pakistan, in countries like Pakistan, we should celebrate this day like at all levels. That's why like we really appreciate the Planet radio that they have arranged this program so the voice could be reached to maximum people in our country.
Thank you so very much, and indeed an honor for us that you are here and telling our people that what's the importance of this day. And coming to you, Dr. Kubra, what do you think that how much significance it is for a woman to breastfeed her baby or her kid in the early stages, or even we have seen that many medical experts, they keep on saying that it has many benefits. What are the benefits?
Yes, actually, uh, when the mother breastfeeds the baby, the benefit goes to both, to the mother as well and to the child. Child, obviously, because the milk is made up of all the growth hormones, vitamins, minerals, and the antibodies, and it gets the baby gets the like defense from the different diseases from mother's milk. So in the especially in the early days, and the breastfeeding is very important. Besides the nutrition to the baby, the breastfeeding is also very important for the mothers because it reduces the different kind of the cancers in the mothers, like the ladies who don't breastfeed their babies, they can get the breast cancer, they may get the ovarian cancer, and the many other kind of the cancers. Because this is the natural process that our body, the female body, is made by the God for the new nourishment of the new life. So our system is also function better if we do that natural process.
Mhm.
So there are many other like benefits for the mother also. Even the mothers who fed their babies in early days, they can also lose the weight that we get during the pregnancy and postpartum weight. Even we cannot get the postpartum depression. Many females who deliver their babies get into the depression. They like uh, this is a natural process because many hormones are working there. If we don't utilize that hormonal balance properly, so the ladies may get the depression, and this is also very common in Pakistan, that postpartum depression, that we cannot educate the mothers, and also this, but also the breastfeeding is very important for the kids in the early days because they are very prone to the diseases, and their organs are not well developed, like their digestive system is not well developed, their respiratory system is not well developed, and their brain is also developing. All these things will be function properly if they get the feed from the mother, because formula milk also is a like supplement to the breastfeeding, but it cannot it does not have the different essential vitamins, minerals, growth hormones, antibodies, and many other things. They just made the formula milk that contain the water and essential vitamins and essential nutrients, but the other things that our baby needs and their organ needs to develop and to mature, they cannot have that. So this is the gift from the God. And also the breastfeeding is also good in the sense that the people in Pakistan can't afford the formula milk, and this one. This is also a easy access, and it's also not burden for the pocket of the parent, and they get the best, they provide the best thing to their child. Even their behavior become very prominent. The kids who fed from the mother, they get the breast they fed from the mother, they are more intellectually more vigilant, and their intellectual level is very high. And even the kids who get from the formula milk and the cow milk and goat milk, they are not very intelligent.
So intelligence also deals with the mother milk,
Yeah.
and we have seen that you have just tell us many benefits about it, like you can avoid any kind of cancers. Even you can you have every mother after giving the birth, the main issue is that how can I can lose my weight, and if you have that in the form of what God had gifted you and your kid by breastfeeding, then you can lose a lot of weight. Besides that, it is a relief of depression and natural medicine that Allah subhanahu wa ta'ala has provided us. Besides that, we have body organic development. It helps in the development of baby's body organs, and besides that, it is much cost effective, and intelligence, that matters a lot. Brilliance of intelligence. If you want to make your kids intelligent and with the brilliance of mind, then you must feed your kids. And coming to you, Dr. Aftab Ahmad, just want to know that what is regenerative medicine in which you are specialized?
Okay, actually, this is a new area. Initially we were mainly focused on the medicine. They have different impacts on the body. Just like we have some disease, we go to the doctor and they prescribe some medicine, and that medicine has some benefit. Like if you have a headache, they go to doctor. If you have a fever, then go to the doctor and they will prescribe, okay, take two Panadol and you will be fine. The regenerative medicine is a totally different field. In regenerative medicine is actually a field in which you regenerate the body. If like your organ is damaged, then instead of medicine, you try to regenerate that part of the body. For example, if you have some liver damage, then in regenerative medicine we try to heal the liver so it regain the function once again. So it's actually just like the name indicates, it's regenerative medicine. So it very much on the regeneration of the process. Just like there are so many examples we can take. For example, if we are getting old, there are wrinkles on the body. So you can regenerate the skin and wrinkle will be back. So you will not get
without
any
any plastic
wrinkles.
surgery.
We are getting the gray hair. So that's another challenge as we are getting old. So in regenerative medicine, we regenerate the hair once again. So it's actually, if we talk more technically, it deals with the cells which are called the stem cells and many of the growth factors which are present in our body. So we should utilize those stem cells. We try to like increase the number of stem cells inside the body. Or if we talk on the growth factors, we can increase the concentration of certain growth factors in the body. That meant to regenerate the organs. So it's like if I talk specifically, now it's the era of regenerative medicine all over the world. So everybody is going towards, you might have seen this practice as well. Initially, people used to go for like the medicine and surgeries, but now they are moving more towards the regeneration. Just like you might have heard that people have gone for PRP therapy of the face, PRP therapy of the hair. So it's all about the regenerative medicine.
Okay, and there's a sub question in my mind, and if it is in the initial stage or it is more developed, what do you think that in Pakistan is there a successful formula or success story of regenerative medicine?
So actually, this is a pretty new area of research. There is a lot of research work going on all over the world and also in Pakistan. So in Pakistan, it's actually at the very initial stages. There are many researchers, many clinicians now practicing the regenerative medicine. For example, we have seen so many patients who have the problem of this knee osteoarthritis. So they have the pain in the knees. So one of the solution is like if you are at the initial stage, you can go for some medicine and you will heal it. But if you go to some clinician who is practicing the regenerative medicine, they will go for PRP therapy initially. If it's fixed, that's fine. If it is not fixed, then they will go for the stem cell therapy and they inject the stem cells into your knee, and this is how they heal the problem. So it's like in some of the countries it's pretty mature and many people are going there. For example, in the whole world there is a huge burden of diabetes, especially in Pakistan as well. Like 1/4 of our adult population is suffering from diabetes. So if you have to heal it, like the only solution is regenerative medicine. You regenerate your pancreas, then you regenerate the beta cells in your pancreas. So this is how you can heal the disease. So that's why like many researchers are practicing this all over the world, and it's also becoming popular in Pakistan.
Okay, that's good to know. And coming to you, Dr. Kubra Mehmood, what about your specialties? I'm talking about the applied sciences. More of our audience, I also want to know that what's the benefit of this?
Actually, applied biosciences is actually, I'm working on the different areas. My research is on the signaling pathways. So we studied a lot. When we do our research in PhD, it is more like in deep depth of the any topic. So it's like signaling pathways are like the neural system. That's how the signal we perceive and go to the different part of the bodies and different areas. So this was my research. But I started my mother's club when the first time I became the mother. Then I realized there are so many myths. And even unfortunately I met different doctors, they even don't know the reality, because we are the scientists, we do research on everything. When I became the pregnant and became the first time mother, I researched a lot. Then I realized there is a huge gap for the Pakistani mothers, that they don't have the basic concept. Even one thing that I observed that during this course of time, that when baby born, we say that only 1 or 2 months are okay, that they can feed on the mother's milk. Then we transfer them to the goat milk or the cow milk. because the baby becomes so chubby and
Hmm.
it looks so healthy. Actually, if we see the comparison between the breast milk, cow milk, and the goat milk, this is the huge difference. Because for the first 6 months, our baby needs the lactose
Mhm.
milk in large amount because their digestive system is not fully developed. But if we see the chemistry of the breast milk and the cow milk and the goat milk, in cow milk and goat milk there is a more fat and babies don't have that system to digest it and they have more protein instead of lactose
Mhm.
and they get more becomes more fatty and get more protein and we think they are healthy. Look, you are breastfeeding your child, your baby is not healthy. The baby who is feeding on the cow milk, he's or she, that kid is so chubby and beautiful and healthy. Actually, he is not healthy.
Hmm.
He has the many chances that he can get the different allergies because they need the lactose. But in the milk, cow milk and goat milk, there is less lactose and more protein and more fats because their milk was made for the animal babies
Mhm.
because the animal babies
Right.
have their digestive system and their body need more protein and more fat because they have to get up in a day or two and start grazing the grass.
Mhm.
Because our baby and we are human and this practice is very common in Pakistan. Even our family, then we educate them that we have to stop this.
You're right, and there's a difference between omnivores and carnivores,
Yeah.
why we're mixing all these together. And even you're much right that we need to avoid such things, and there are many myths in our society. And if we can, and if we must avoid those things, then of course it will be a good society. It will be a good, much educated one, and with the maturity, where we can not only heal our kids with the natural processes like the organic foods. Even the Allah Subhanahu wa Taala that has blessed a mother with this feeding, milk feeding, and if we are able to provide our kids with the specifics and basics, then of course they will avoid any kind of diseases either. And coming to you once again, Dr. Aftab, and I'm much surprised about the regenerative medicines, and as you have just told that we can regenerate our organs, and even you don't need to go to any specific or big surgery or even a small surgery like knee replacement or liver transplant. Can we avoid big transplants like kidney transplant, liver transplant, and any other transplant besides that? Can we have the replacement, the new technologies of knee replacement and even the elbow replacements? Can we avoid all those things with the help of medicine only?
Yes, so as we were discussing that this is a new area of research and a lot of research work is going on. So yes, at many stages, initially, especially at the initial stage, if you go for the regenerative medicine and if you go for stem cell therapy, you can improve the situation, just like you can improve the liver function.
Right.
Liver has the potential of regeneration, so it it has quite a good capacity of regeneration. So it do, but at certain stage, it lost the regeneration potential. That's why we have to go towards the regenerative medicine. Similarly, for the kidney, lot of research work is going on all over the world. In Pakistan, we also have a lot of kidney issues. We have now like millions of patients who are suffering with kidney problem. So everybody is looking, and there is a hope in the future that we will actually help those people to regenerate their kidneys, especially at the initial stage. And there is a lot of interest in this area, and a lot of research work is going on. Even if we talk about like my postdoctorate studies in tissue engineering, so I have done tissue engineering postdoc from Japan. So my work was on how we can grow those organs in the laboratory.
Right.
The challenge is like if I have a liver problem, what we have to do, we have to match another person, and if we have we have to go with many people, we have to do the matching with those people. That's like technically it's HLA typing. So we have to match the person. So then there is some, especially the close relatives who have a very good match for you. So in that case, what you have to do, you have to open the person, get a piece of the liver from that person, and then you have to transplant in the diseased person.
Right.
So there are two major operations in that case. And in Pakistan, like in the news, if you see, I also gave presentation at several forums that there are so many examples that a young boy who was a university student, he gave part of liver to his mother, and he died because of infection. And sometimes the mother died, or sometimes his father died. So this can happen because there are a lot of chances of infection as well. So what we can do, in the beauty of regenerative medicine and the beauty of tissue engineering, is what we can do, we can prepare a scaffold in the laboratory. We can take the person's own cells. So in that case, for example, if somebody having the liver problem, we can take the cell from that person. We can grow those cells in that scaffold, in that structure, and we can make piece of the liver in the laboratory, and that is exactly the match with the person. So in that case, you just have to open that person who has the disease, and you can transplant. So this is very much coming, and there are some success stories from Singapore. They have done this. They have grown the liver in the laboratory, and they have transplanted, and it's quite successful. So this is a start. But in the future, like in coming, the much advancement we have seen recently, in the coming like 5 to 10 years, this will be quite possible. Like if you have some damaged part, I know a lady who has a damaged trachea. She was from Spain. So they actually grew their trachea into the laboratory from her own cells, and they transplanted, and she's still alive. So this will be a common thing in the future. Like you have, if somebody don't have the ear, we can grow. These are much simpler. This is the cartilage only, and some like connective tissues and cartilaginous cells we can easily grow. For the complex organ, this will be a challenge, because being a scientist, I know that it's like complex organ, and orientation of the cells is important. It's only not limited to, for example, heart is not only the cardiomyocytes. There are fibroblasts inside. There are endothelial cells. There are so many different type of cells which actually working together to make those complex organs. So it will be like a bit challenging for the complex organs, but for the simple organs, yes, in the very near future, we will be able to grow those organs in the laboratory, and we will be able to transplant to the patient. So this is like hope to millions of the people across the world.
I agree, and even with the advancement of AI, we are going to see that how much, there will be beautification even, and there will be more perfection in that era, and even we will see that in that field people will gonna enjoy all these outcomes and fruition either.
Yes, and just to add one more thing, I just remember. So I'm also working in one of the university, that is Pak Austria, Pak that's close to Islamabad. So in Pak Austria, there are two such printers now. They are called the bioprinters. So we have literally the printers now. One is in Alabama University, one is in Pak Austria. So you can literally print the organs in the laboratory, and then you can use it further. So that's the start. They are doing the initial experiments, but in the future, like if you have to print the skin, for example, if you have a person with some skin problem, maybe diabetic person who can't heal the skin, or if there is a person who has like burned the skin. So in that case, you can get the cells, you can print a piece of skin through the bioprinter, and then you can transplant to the patient. So this is like the things are much advancing now. Even in
that's a
Pakistan.
pleasant surprise for me, and even shocking one that right now we are going to generate organs like these are the printers, and if you want something, then you can just go and print that thing. And coming to you, Dr. Kubra, we just talked about the benefits of breastfeeding. What are the basic tips that you want to give to the mothers that they can have breastfeed in such a way that it will be much benefit for them and for their kids?
Okay. Actually, the first tip is that the first time mothers, the ladies and the girls who becoming the first time mother, they think that breastfeeding is a painful process. Actually, it is not painful process. This is discomforting for the few days. This is just a matter of 3 or 4 days, because body is changing, and our hormones in the body. Actually, our female bodies are we are working according to our hormones. So our body is also acting according to the hormones. So there are so many hormonal balancing and disbalancing in that period.
Right.
So we feel that this is discomfort. But when the mother start feeding to the baby, the things get settled down. All the body system start settling down and all that. And also when the baby start feeding, the body gets the signal that baby start feeding. It's the natural process. The mother start producing the milk. We think that okay, we mostly the new mother thinks that the baby can't get the enough milk for the to satisfy his hunger, but this is not. The natural process is that if you feed more to your baby, your body produce more milk.
Right.
So if you think that he is not getting the enough milk, I think I should give him a formula milk. Then the body gets the signal that the baby is not feeding, so our body don't produce the milk. So start the like what would we use? Exclusive feeding. The baby needs exclusive feeding for the first 6 months, because this is very important. And besides that, I want to mention one more thing, that many people think that we have to give water to the baby because they are crying and their throat may dry, and
yeah.
Like we also made many kind of the kahwas for the baby. Actually, water is very dangerous for the babies, especially the newborn baby. First 3 months, water is like a poison for them. And after 6 months, their digestive system get developed, and they can take the many different things. So we can introduce the water after 5, 4. Even though some people introduce the water and the solid food after 4 months, but the first 3 months there is no need to give them like kahwa and different type of water, and I don't know, there are so many things in our society that people use that they are doing because they think that they are practicing from the old time. So this is the good thing. Actually, this is not. Actually, if we see the present situation, many kids are gluten allergic. Many kids are the lactose allergic. Actually, these are the practices that we do in the start of their life. So that's why they get the different type of allergy. If we see the let me go into the chemistry of the mother's milk. There is the two type of protein. One is the whey protein and other is the casein protein. Whey protein is the if we see the yogurt, we see that there is some water in the yogurt, and other is the curd, like solid material. The curdy type of protein is the casein protein, and the watery protein is the whey protein. Yes, the animal milk have more curd protein, casein protein, and less whey protein. Actually, whey protein is only like 80% of the mother milk contain the whey protein. And benefit of the whey protein is that it is full of anti-infected proteins. If your baby gets any kind of disease in the early days, like fever, flu, sore throat, diarrhea, and vomiting, anything, your milk, only your milk can heal. If we go to the doctor, they give the different type of antibiotics, they are doing wrong. Because only mother feeds, it contains all the antibiotics, all the infective protein in their milk. If your child is sick, feed more frequent. He will heal. The kid will heal. So there is no need of any medicine. Maybe if your child has a fever, you may use the Panadol for the reduction. But in the early days, for any infection, the mother's fluid can heal that infection. And one more interesting thing, sometimes I feel so blessed that I am a female and I am a mother, because Allah has gifted us so like magical powers.
No doubt.
I think with these things we should actually. There is a huge gap, because before becoming a mother, I was not. I was unaware of all these things, because I did my PhD. I studied a lot about science and whatnot, so many things, but I never studied about this. So actually, when mother get infected, one of our myths is that if mother get any disease or get infected, she should stop the breastfeeding, because baby may get that disease or infection.
Right.
This is not happened. We are the blessed by the God. Whenever we mother get the infection, our body produce the antibodies.
Right.
These antibodies go to the milk, and when our baby feeds that milk, the antibodies go to his body, and he automatically get protected by this disease for the future even.
That's the organic way, that's the natural process, and that's a process that Allah subhanahu wa ta'ala has just introduced to the human body. And indeed, there are many benefits, as Dr. Kubra is just telling us. And coming to you, Dr. Aftab, you were just talking about the regenerative organs. Are these cost effective, or they might be much costly? Even people would say that rather having that technology to be utilized, they will avoid that because of the cost and heavy expensive therapy too.
Yes, you are right. So whenever any therapy is available at the start, is quite expensive because you have to spend a lot of money to do the research and do the trials. So initially it's very expensive, but as it becomes common, then it will not be that expensive. I can give you the example of, for example, the recently. Initially, for the cancer therapy, we used to go for the chemotherapy most of the cases. That's like one way we can go the radiotherapy, and we can go for other approaches as well, surgery and many others. But recently, it also moved towards kind of regenerative medicine. So there is one therapy which is called CAR T-cell therapy for the cancer treatment. So it's super expensive right now. The treatment is like around $35,000 for one patient. So even like majority of Pakistanis, they can't afford it. But with the passage of time, it will be very cheap. So like maybe after a few years, it will be around $1,000. So it will not be that expensive. So yes, right now the stem cell therapy is quite expensive. I know so many people. Like I met with the CEO of one of the company. He said that you are working in the regenerative medicine, so I want that we should do something in Pakistan, because he went to one of the European country for the treatment of diabetes, and it cost him around 10 million rupees, more than 10 million rupees. So that's a huge amount. But like you know that Pakistani can't afford that much money. But now the prices has much reduced, and the technology is also improving. And many centers, even in Pakistan, they are in the process. There is one in Islamabad. They have started functioning. Ahmad University is building a huge center for regenerative medicine. So they are also in progress. So not only these, but many other hospitals. Like I know in Children's Hospital Lahore, they have now a dedicated lab working in this area. They were very much interested. Initially, I also worked with them. So many of the hospitals, if you talk to know any hospital, any advanced hospital, they are thinking about the regenerative medicine. Because this is like after maybe 5 to 10 years, regenerative medicine will be the medicine. So people will go for regeneration rather they will taking the pills. And because in case of pills, even check the Panadol, you will see that there are they will give you list of around 100 side effects of that pill. So there are so many side effects of all these medicine. That's why people are like thinking that we should go for more towards the regeneration, so we can regenerate our organs and we can have a better life. So yeah. So initially it's like expensive, but as the technology will do, I'll give you another example.
Sure.
That's more like science. So initially, the Human Genome Project was started back in 1990s, and the initial cost of sequencing the human genome was more than 3 billion US dollars. And many laboratories from US and Europe, they were involved in that project. And then the prices were getting down and down and down, and now it has gone to around $1,000, and maybe in 1 or 2 years it will be $100.
Exactly.
So in $100, so it started with 3 billion US dollars, and it will now end up in like $100, and you can sequence the whole genome. Similarly, for other technologies, they are expensive, but as there will be advancement, the prices will definitely go down.
Exactly, and with the passage of time we are gonna see more clarity, we are gonna see more advancement, and we are gonna see that more AI involvement in those organ development.
Definitely, AI is like AI in healthcare is like now people are taking more advice from the AI, and even they think that AI can give them better advice than the doctor. So
Exactly.
yes, it's becoming very popular, and even like in some cases, even it's published now that the AI has given better advice to the to the patient than the doctor. So AI is in the healthcare is a big thing in the future. Definitely.
And it's cost effective too.
It's cost effective, definitely.
Yeah.
And like I just wanted to add like what Dr. Kubra she was saying, especially in Pakistan. I think she better knows the statistics than me. One thing I talked that the health index of Pakistan is not that good. We are after 100 countries, even after 150 countries. But the ratio of breastfeeding is also not very high in Pakistan. So I think Dr. Kubra she will elaborate the exact statistics. But according to my understanding, it's like less than 50% right now.
So 45.2% is the initial starting of the breastfeeding, and 48.5% is the exclusive. Exclusive. When we use the word exclusive feeding, it means that the mothers who fed till the 6 months their babies. It's this statistics shows that it's also very less percentage, 48% mothers. And it also I want to tell you that during one of the survey which was conducted on 2018, these percentage was very less. Only 18% mothers start the early breastfeeding, which was the very lowest. Very sadly, that was but now the percentage has increased, but still it's very it's still less than the 50%.
And according to your research, why is it so low?
There are the different kind of the myths. Many the working mothers think that they don't want to like let's take their kids because they become dependent on their mother feed.
Right.
But there are the solutions. If you can't, you're a working mother, you can pump the milk and put in the fridge. And who is the person, a lady who
Babysitter or caretaker.
Caretaker, you can guide them. They can provide their feed. And even I have a twin, and there was a lot of problems during the early days that feeding them, because they I can't, because when one kid was hungry, the other thing start crying that he is also hungry. So what I used to do that I pump the milk for one kid, and I breastfeed like with myself with the one baby. So one started the breastfeeding like with a feeder, and one with me. So we can manage the things. And many new mothers think that this is very painful process, and we get fat, and our body becomes so ugly. No, if you are a mother, you are beautiful.
Exactly.
And one more thing, that when we breastfeed our babies, we become slimmer because our fat was utilized in feeding. So we reduce our weight very early. These are the common problem, and many people think that mothers are the very some in families that they think that the mother is very weak. If he start breastfeeding, he become more weak.
Right.
This is not scenario. They started the cow milk to the children or the formula milk to so they think that the mother will become healthier after that. No, this is not it, because this is not the natural way, because God created our body in this style that if we feed our we also get the health benefits, and our
Right.
babies also get the health benefits. So we have to change this thinking that mother becomes even some mothers think that when we breastfeed we feel dizziness and
Hmm.
we feel very weakness. Actually, if you feel like that, go for the blood test and check your anemia status, yeah, or the iron deficiency or any other health issue.
Mhm.
So breastfeeding is doing nothing with you. It's a healthy process for you and your baby.
So these are just the myths that women also always say. Even young girls, they keep on saying that we are feeling dizziness or even weakness. So as Dr. Kubra has told us that there's no contact between the weaknesses, dizziness among the mother due to that breastfeed. There might be some issues, and you need to consult your physician in that case. And besides that, we were just talking about that the regenerative medicine, a new topic that is just gonna introduced in our program, as we were not just planning to introduce that, but it was quite a surprising pleasant surprise for me that came to know that regenerative medicine and technologies can build new organs, and if you can avail that, then you can have any kind of organs in your body. And there is a specific structure or specific nursery where they are going to form new organs, and they are going to just transplant in your body, and you will be like a new person, a new energetic person, and you will feel more younger. And coming to you, Dr. Aftab, once again, what's the current status of Pakistan in their regenerative medicine?
So yes, in Pakistan, lot of laboratories they are working in this area. Especially one center established as part of Punjab University Center for Excellence in Molecular Biology. They have a laboratory related to cell biology working since 1989. So very like old center is
Mhm.
working there, and now they have a dedicated stem cell laboratories. They have dedicated laboratories for each organ. So they have dedicated laboratory for the eye
Mhm.
related cells. They have a dedicated laboratory for the liver. They have a dedicated laboratory for the skin. So they have now the dedicated laboratories working there. As I mentioned, our university they have also poured a lot of money in this area, and they have now established a center for regenerative medicine there. So these are just two examples. Now almost all the universities they are thinking to establish these laboratories related to regenerative medicine. Not only the universities, but also many research centers they are also interested. So we have one like stem cell laboratory in National University of Science and Technology. We have one laboratory in Prague, Austria, Pakistan.
Mhm.
So the Department of Biomedical Sciences, they have a dedicated laboratory working in area of stem cell biology. So there are so many now laboratories in Pakistan. They initiated, some are the older one and some are the new one. And the good thing is in many hospitals they are also starting these kind of laboratories, so they can also practice. Like they are optimizing the protocols. The optimization is very important
Hmm.
because without so what we have to do in Pakistan, there are some like international laboratories. Just like back in 2018, I was in Duke University in US. I was there. So in Duke University, they have a huge center for autism. So autism is also very common
Mhm.
in Pakistan. So they were doing the stem cell therapy for autistic kids, and they have optimized the protocol. So in Pakistan, what we had to do, we also like start some trials initially, like how we can isolate the cells, how we can grow those cells, how we can increase the number, and then how we can do the transplantation. So what we can do, we can follow the international guidelines in Pakistan. That will be the optimal solution. As I mentioned, that regenerative medicine is becoming very popular, and many centers they are even getting the cells from overseas and they are transplanting to the patient. But the thing is, we should follow the standardized protocol. Rather, like if you have the cells, you can get the cells like in ₹1,000,000, and you shouldn't inject to everybody. We should follow standard protocols for everything, and that's very important. Otherwise, like if we don't follow those, then there may be some health issues related to it, because like if you are getting allogenic cells, so these are a bit technical, but there are like autologous cells. Autologous are if we are getting from the patient, they are patient own cells. They are called autologous cells. So there are less problem with those. But if you are getting allogenic is if you are getting from another source, from another person, then there could be some problems as well. So there are risks as well. That's why we should follow the international standards, also the national standards, and then we should go for it. I know during the COVID era, Pakistan imported cells worth of like millions of rupees from Malaysia, from some other countries, and they also done the transplantation because for those people who had the severe lung infection and they tried to regenerate those. I know one of the trial happened in one of the hospital in Islamabad, so they also imported a cell. So this is like becoming very popular in Pakistan. Especially, I must say that the Pakistani laboratories should also come up because otherwise, just like we are importing the other stuff, we have to import the cells for regeneration. So we should also do like more research and development in Pakistan so we can establish more laboratories. And with those laboratories, we can not only it started with the growth factors like the PRP, then it went to the stem cells. Now there is more advancement, like we are talking about the exosomes and some other stuff. So these are the very tiny, these are not the cells but the tiny structures, they are secreted by the cell. So I know that Pakistan is importing a lot of exosomes for different health conditions, but the thing is like we should do more R&D in Pakistan so we can isolate those exosomes and stem cells in our country. So like if you import, for example, then it will cost you like around $1 million. It's quite expensive. But if you will develop in Pakistan, it will be initially it will be 10 times less the cost. So many Pakistani will be like able to get those therapies.
They will be beneficiaries of those therapies. And coming to you, Dr. Kubra, once again, there's an issue of colic in the initial state of a baby when he gets the mother feed, and even the old ladies in the family, they keep on saying that you need to try some remedies like homemade teas and kava. You need to give that so that it won't have the issues of colic. Is it a correlation between the kava and the colic, or there are some other things that are more workable than this formula?
Yeah, actually, two of my kids were also colic, and I can I can better tell you that. If we feed our baby, actually, for the first time, I was feeding my baby with a formula milk, and he got the problem of being colic, na. So then I go to the doctor. Fortunately we had a very good doctors. They told me that through all the feeders, all the formula milk, and any kind of things you are giving to your baby, only give your baby your mother milk and the breast milk. So I started the exclusive breastfeeding to my baby. So things changes, but there are some herbal medicine also available for the colic. Like they are with the, I don't know their brands, but they call the colic drops. So we can use these, but they are the herbal, not the allopathic drops or allopathic medicine. So we can reduce the pain of the baby with that. By using these drops, and if we start the exclusive breastfeeding without giving any kind of extra thing, the kids don't get the colic problem. Yeah. The one of the reason is also the feeder. They get more air inside their tummy, and the tummy become the like
gastric, it is absorb more air.
Actually, in my case, when I have the twins, second time I have the twins. So one of the babies I told you that he is on the mother feed, but he gets the feed through the feeder. That kid got the colic problem because they suck the empty feeders and they get some air in their tummy, and this problem will happen. So avoid the feeders and give your baby the explosive breastfeeding as much as you can.
Okay, that's a good tip either, and that you need to avoid feeders. And in any other case, that if your baby is on feeder, then avoid that if he's just sucking that empty feeder. So you need to just to replace that, or you can just refill it, so that there should not be any problem of colic. And coming to you once again, Dr. Aftab, want to know about the, as you just mentioned about the eye regeneration, that people we have what we have seen with the disabilities during their early childhood, or even by born if they are dealt with any kind of disability. Is there any formula, or is there any regeneration of the parts like eyes, eardrums, or vocal boxes, so that they could have any don't have any kind of disabilities in the future?
Yes, it will be quite possible in the future because now the like for the cornea transplant and the cells in the cornea transplantation is becoming very common in the world. So people are like transplanting the cells instead of the whole cornea, and they try to regenerate. It depends how much severe is the condition. But if it is entirely not working, just like we have seen like some of the recent studies from Italy, there were people who are totally blind, and they could restore their vision after the transplantation of the cells. So this is like actually each organ is quite complex. It's not only like the cells who can receive the light and they can project those light, but it's also the how it is communicated to the brain. So sometimes the connection is lost. So in that case, they can also try to like transplant in a way that they can develop the connection with the brain, and they can. So there are like studies you can also like people can Google it. It's been done in Italy. It's been done in many other European countries. It's in progress. So like totally blind people, they can even get like vision. So another thing, another topic, like sometime we might come. There's also one of the area I also work in US is the gene therapy. So another approach could be the gene therapy. So sometime for the hereditary diseases, like there is a gene defect in our body. There are so many. There are more than 6,000 genetic diseases. So in those cases, like genetic diseases, they are super complex. For example, there are people with there is a defect in the genes. You have seen people with the microcephaly. They have very which we call shadola,
right.
so those kind of, so they have that's actually genetic disease in which you have a shorter skull, you have shorter brain. That's one of the genetic disease. There are thalassemia is a genetic disease. There are so many other genetic diseases which are also very very common in Pakistan due to the cousin marriages. So one of the solution could be if we advance the technique of, so regenerative medicine work very closely with the gene therapy. So in some cases you can correct the problem with the genes only. So you don't have to do the transplantation of the cells, but you correct the faulty genes inside your body. Just like it was done like 30 years ago. One of the disease was SCID, severe combined immune deficiency. So that was one of the disease in which the baby actually they don't have a good immune system, so they can catch any disease and they can die. So in that case, they actually removed the faulty gene with the corrected one, and the ailment was gone. So it like is the another approach is the gene therapy. So sometime I think we will come together, myself and Dr. Kubra, because this is also her area as well. So gene therapy we can talk in more detail. I wrote a book, but it is yet not published. So I wrote a book in Urdu on gene therapy as well. It is in process of publication through Urdu Science Board. So I think that will be good information for the clinicians as well, because clinicians they study more about the biochemical processes and the disease and the medicine, the allopathic approach. But these are the recent approaches, like how you can use the gene therapy to correct the faulty genes. As I mentioned that there are more than 6,000 diseases. They are the genetic disease, so we can also work on other diseases are like muscular dystrophy and many other examples of those diseases. So there is work going on in Pakistan. Many researchers are working in our country as well. I know one of my friend, his name is Dr. Jawad. He's working in NAMS. So he has named one of the genetic disease with his name. So that disease name is Jawad syndrome. So I just gave you the example that Pakistani researchers, they are also quite actively working on
No
those
doubt.
genetic diseases. So we are working on the genetic disease, but we also work on the therapy as well. It's not only like we can identify the gene, it's also about that how we can work, and especially in the area in the era of AI, we can have a better approach, because now AI also helping us to find out the best drugs as well.
No doubt.
So that's, and also so we can also try the AI in the genetic diseases and also in regenerative medicine. So another topic I'm also working, so someday might come up with that. So I'm also working on the aging process, how we get old and how we can have a better better and healthy lifespan rather we get old. So we die young after like 100 years. That's the area I'm working for the last more than 10 years. So that's also very interesting kind of discussion. I think the audience will also be very happy to listen that how we can have a like extended lifespan in the future. So in the future you will see that people will be like 100 years old, but they will be still younger. So I remember like one of the approach we used, I was working in US back in 2008. So one of the project I was working was induced pluripotent stem cells. So that's a way in which you can actually convert the old cells back into the
New
baby
ones.
cells, the very new one. For example, if somebody is 100 years old, the brain cells will be 100 years old. So we can reprogram them back to 10 days old cells. So 100 years old cell can be reprogrammed back into 10 days old cell. So this is quite possible. So this is happening all over the world, and there are like so many fascinating work is going on. It's like these are the wonders of science.
No doubt, these are the wonders, and I am just feeling that I'm right now sitting in a studio of a Hollywood movie, and where an expert is just telling me that such miracles could happen, and people, as you are talking about the aging and under-aging situations, of course, the ladies they will be love to contact you, and they will call you not a doctor, they will call you a magician, and
Even we have, this is not a current topic, but we also made some this kind of rice also. We are producing it in Pakistan, and they contain the one of the compound anthocyanin that reverse the aging, that also good for the brain health, also for the skin, and it can also, if you have any chronic diseases, you can get the benefit from that rice. This is the reverse of the white rice that we are eating.
So just one thing I would like to add. So on one side, we are talking about this technology, but on the other side, there is a very sad story. Sad story in the sense that if we talk about the mortality in the child, Pakistan is unfortunately has the worst statistics in the world. Even we are after Yemen and Afghanistan. So if we talk about like death in children under the age of 5 in the world, the ratio is like in 1,000 babies, 65 baby die in Pakistan. Even in Afghanistan situation is better than us. Even in Yemen, in Syria situation is better than. So on one side we are like talking on the advanced technology, but on the other side the situation. That's why we should like put more emphasis on our health. We should put more money on the health infrastructure on one side, and on the other side, just like the program is today about the breastfeeding. So we should organize these kind of programs. The good thing is like the situation is improving. Like I mentioned that the worst scenario is in Pakistan. If we talk about the neonatal mortality, neonatal is like the early 1 month. If somebody died, we have the highest ratio in the world. If we talk about the early, so infant mortality, infant is like 1 year half age. So if we talk about the infant mortality, we have the highest in the world, unfortunately. So our statistics are really bad, even in the whole region. If we talk compared with India, with Sri Lanka, with Bangladesh, we are like much behind those countries. So on one side, unfortunately, and the reason is for this mortality is unhygienic practices, early infection, especially the respiratory infections. Diarrhea is very common in Pakistan. And what we can do, the cure is the breast milk. The cure is if you can feel like as I mentioned that on one side we have worse statistics. The other thing is our mothers also not feeding is less than 50%.
Mhm.
So they can like almost, it should be more than 90%.
Right, right.
But the on the other side, but the good thing which I mentioned, and Dr. Kubra also mentioned, that from 2018 the statistics are much improving. For example, if we talk about the stunted growth, as it was also mentioned by our leaders, that it
Right.
is like 45% or 44% Pakistani children are stunted. The ratio is getting down. It's like around 40% now, but not much improved, but there is improvement. If we talk about the breastfeeding, exclusive breastfeeding, as Dr. Kubra, she was mentioning, that it was around, I don't know what was it, 30, yes, in 2018,
Yeah,
and now it's
48.
48. So the things are improving. That's why how it is improving, because there is more awareness now, and I think programs like these, and it should be not limited to the radio, but also it should be on the television,
Right.
and also on the social
Social
media,
media as well.
that we should promote, like we should encourage the breastfeeding. And even the theme for 2024 is closing the gap, breastfeeding for all, breastfeeding sport for all. So I think we should like close the gaps. We
Right.
should encourage all the mothers that they should go for. And this is like, I was also reading the statistics that even for like the premature babies who born early, the best thing is the uh,
Mother
the,
milk.
the mother milk. So that's actually a great remedy for them, for their brain development, for their earlier development. And the best thing, the best gift mother can give to those kids who are born premature, like in the 7th month or in the 8th month, is the breast milk.
Because their lungs are also not very mature. Although the doctor gave the specific steroid injection to the mother for the lungs maturation of the baby, but still the lungs are not mature. So the best thing we can do and we can give to our children is the breast milk. It contains all kind of antibodies and infective proteins that baby get from us and get healthier, and if the baby get less prone to the different diseases, different chronic diseases. Okay. And one more thing that I want to mention, that it's not about the diseases, it's all about their personality, because the brain cells also get the healthy vibes when they get close to the mother. Their emotions are more stronger than the children who are not very close to the mother.
Right.
And their growth and their even their emotional and intelligent like level is also very different. So if we want to make their personality strong, their health strong, the only remedy is the breastfeeding.
The only remedy is the breastfeeding, the audience, and the biggest regenerative medicine, I must say, is the breastfeeding bestowed by Allah subhanahu wa ta'ala. And it helps the kid to regenerate not only their organs but also to avoid many kind of diseases, whether they are seasonal, whether they are chronic, whether they are communicable or even non-communicable. And even just want to know both of you about the formula milk. I have just read an article of Harvard University. They just said that any kind of powder form of nutrition or supplements, they are more injurious to your health. They have more side effects. Why is that so?
Well, as we were discussing previously, first I should mention the statistics, which
Sure.
are very, very important. That if you are on the formula milk, or if you are on the cow's milk or goat milk, the chances of deaths are 14% more in those kids which are on the formula milk or on the other sources of nutrition, rather on the breast milk. So you can imagine, like 14% is a huge, huge number.
No.
Like 14%, I must say that it's a big number. So we can avoid those deaths, 14% deaths, if we go towards the breastfeeding. So as Dr. Kubra mentioned at the very start, that if we see the composition of the formula milk and also the breast milk, she has rightly said, so it has the balanced nutrients. So it is according to the need of the kid. So it has the lactose, it has the respective glucose,
And
so it has the
the
proteins.
more important protein is the whey protein. That the mother milk have more whey protein, and the mother milk is composed of about 80% is protein composed of whey protein, which have the all the infective protein that
Anti-infective,
protect the
yeah.
anti-infective protein that protects the baby from the
Infection.
infection.
So I yes, just to like second Dr. Kubra. So I was like also going through the list of those things. So it has like hormones. It has the enzymes inside. So hormones and enzymes are missing in the formula. It has the
Both
antibodies.
Mhm.
Antibodies are totally missing in the formula. So like antibodies are there, hormones are there, growth factors are there, and the balanced form of nutrition, nutrients, minerals, everything is there in the breast milk as compared to the formula milk. That's why. And other like beauty of the breast milk is it has a very different composition. For the like first 3 months it has a different composition. Next after 3 months it has a different composition. So Dr. Kubra can better explain to that. But another like beauty is the very first milk is a colostrum is totally different. Then the early milk which is coming for the baby is different formulation. The late milk is different formulation. So it is like if you go for towards the formula milk, it's the same all around the year. So from the first day it's the same. After a year it will be the same composition. But the mother milk is according to need of the, if that is sick, then it has like it will contain more antibodies. It has just like Dr. Kubra was mentioning that it has the hormone like oxytocin is there. That is a love hormone. So you feel more love. It's also released more in the mother. It also goes towards the baby. So baby is more charming. Baby is more loving if you are on the breast. So if you talk about like the benefits of the breastfeeding, I was like, we were having the discussion before coming to this program, and we were like having some discussion because she gave the presentation. I was in the presentation which she gave yesterday in NUS. So I also was very much interested to know like, and then I also came through some of the statistics that I just talked about beside my field. But I was totally amazed, and this is what Dr. Kubra was also mentioning, that this is the beautiful gift that we can give to our children.
Children. Indeed, it's the composition of all the ingredients naturally, and the most organic thing that a mother can give to his or her kid. And we just came to know that not only it's a good source of energy, but it's a good source of prevention of many diseases. So Allah Subhanahu wa Taala has produced 100% perfect thing in mother, and a mother can deliver that to her kid. And even there are many myths that we were just raising curtains of, and like weaknesses, dizziness, and even if a mother that has some early pregnancy during the feeding, they always complain about that they are feeling more dizziness. But just want to know that if a mother that with a kid almost 1 years old is on breastfeed, but she get pregnancy, and even the doctors they advise that you need to cut off the breastfeeding right now. What are the consequences, or even what are the alternatives? Does that mother need to cut off the breastfeed to the first kid, or she need to have more supplements? She need to have more good kind of consumption of food rather just cutting off that breastfeed.
Okay, one thing is that when we get the news that a mother is got another pregnancy after 1 year, and what we usually do, we cut off the milk suddenly.
Exactly.
Yes, the kid goes to the grandparents or the other relative for the week and 2 week to avoid the breastfeeding. This is totally wrong procedure. It not only affects the baby but also to the mother. The best way is that if you get the news that you are pregnant, you can continue the breastfeeding for the 3 to 4 months. So you have what you can do. You can reduce the milk slowly, and you introduce more food to the baby, because if his tummy is filled, 1 year old baby is a quite bigger baby.
Okay.
And if his tummy is filled, he don't ask for the milk because he knows that his tummy is filled. He don't have any desire. So cutting off the breastfeeding, we should cut off the breastfeeding slowly. There is no need to cut off suddenly, because this is the emotional trauma for the baby.
Agree.
And also for the mothers. Even mothers' breast also gets sore, and they get the sometimes they get the different infection inside the breast when they are not giving milk to the babies. So the best thing is that you can continue the breastfeeding till 3 to 4 months, and then your baby will also settle down, and it will shift it to the solid food. So after 6 months, the baby, we should introduce a different kind of a food to the baby, so he gets the different nutrients, because his body requires a different type of a nutrient, not on the lactose. So there is no problem that one can discontinue the breastfeeding after 1 year also. So we can discontinue slowly, not suddenly. This is the yeah.
Not
key point.
rapidly, and even there are many consequences as mentioned by Dr. Kubra. And coming to you, Dr. Aftab, once again, that how we can improve, as you have just told that there is a ratio of almost 50% that mother avoid breastfeeding. How we can have some, good awareness raising campaigns, or what medium we need to use to aware that mother that it is not only beneficial for your kid, but it's much beneficial for your own health.
Yes, I think this is even we were the same question was asked to Dr. Kubra yesterday, that how we can improve the situation, and I think she can better explain. But I would like to add one thing. I think we should start at very early stage, especially we can talk to the girls at the school level. We can tell them the benefits. So if the teen age is very emotional age. So what information we give at the teenage is that mostly stays, because some information, if connect with the emotion, that stays with you for a longer time. So I think during the teenagers, during our school days and college days, we should provide these kind of information to the girls as well, that these are the health benefits, and these are the health benefits for you. These are the health benefits for the babies. So I think we can educate them at the very earlier stages. They will be more inclined towards. And this is like in Pakistan, there is a trend of something. So if more this trend for the breastfeeding goes, then everybody goes towards that. So if we can set the trend, then I think more and more mothers will go towards the breastfeeding. Rest, I think Dr. Kubra, she can answer.
Exactly, same question to you, that how we can raise awareness.
Yeah, exactly. But I was thinking that I was very good student and I studied in a very good institution, but this thing was missing. I think we should educate our girls in school level, in college level, in even university level. If you are not a student of the medical or the other fields, we are not aware of all these things. But these are very important, because we are the people, even boy or the girl, they are going to start the new life.
Exactly.
They will nourish the new life. So we need this kind of awareness in very early age. So this is very important. And one more thing, that I am very much advocate of mother's mental health. Mostly the first time mothers gone through the postpartum depression. So this is also a very undercover area that we don't discuss about it. That mother also after the delivery, there are the chances that mother undergoes the postpartum depression. So when we breastfeed our baby, we also reduces the chances of postpartum depression. And the sign of depression are very common, like the mother may feel that she is very tired, she is not very happy, she may start crying on a little thing. If feeder is not or anything is not clean, she may start crying that this is not happened, and we think even the husbands and the boys and the other family members should understand that that might be the case that she is undergoing the anxiety that mostly mothers undergo this kind of anxiety and the depression. If we this can be very lethal if we can't cure it. So many there are many like dispute happened that she is not happy with the care. She is not actually
Right.
this is not control of the mother.
Hmm.
She is undergoing to very serious condition that is the postpartum depression. We also educate the even this could be the responsibility of the doctor. I think that they tell the even their father and their family members that there might be the chances that this lady who is a new mother may get the depression or
Exactly.
the anxiety. You have to take care of her emotions also, and this is also a very big thing in our society that we don't think that mother okay we think that oh this is the process of the generation that everyone is like delivering baby, so what's the matter. This is a huge matter actually. This is a very serious issue that mothers are going through this. They are also going through some physical changes and emotional changes, and also they are going through some mental changes. So we all have to understand all these things. Say, like you have to give some space till 3 months to the mother that she can settle down and his body settle down, his brain settle down. So this is a very serious issue. We should raise awareness about it.
Yeah, you're right. And
There is
indeed.
role of like the boys and the male in this case
Yeah.
as well, that they should support the female. So it's not only the girls' education; it's also like I know that due to this depression, also many of the female they don't feed. So we can also increase the number of feeding mothers if we can, like the male, the partner who can also take care, and the family. It's not only the responsibility of the male side, but it's the responsibility of the whole family that they
Exactly.
take care. So that's why we were like together in this program as well, because it's more female oriented program. But I think this even for the yesterday's program we invited the male in the seminar. Some people asked us that it's only exclusively for the female. We said no, it's also the male, that they should also have the understanding that why we should go for the breastfeeding. So yesterday she delivered a seminar in us, so we invited everybody that they can come and join and have the discussion about this.
Exactly, because you're a parent of a kid, and you both have the same responsibility, rather just putting that responsibility on the mother only. And even if you are a mature person, and if you are much humble and sensitive, then you must just take care of your wife and the mother of that kid, that she might have some challenges, some issues during some emotional challenges during the breastfeeding, or even being a new mother. So all these things need to be held with the better understanding. And if you have that approach of better understanding, then of course it will help us to make our life like in we are living in the heavens. And last but not the least, what is your message to our audience?
Well, the message is very important. Unfortunately, as you mentioned, the statistics are very high. Like the early childhood mortality is very high in Pakistan. We can reduce the number, as you mentioned, that 14% is linked with non breastfeeding. So it's very important that we should encourage our mothers that they should go for breastfeeding. Right now we have number around 50%. So next year when we'll be talking to this program, it should be more than 60%, and it should be gradually increased. And awareness is very important. So we should start awareness at all levels, from the school, colleges, universities. On social media, we should also ask the influencers to talk about this important matter, because many people listen to them as well. So it's not only the responsibility of the healthcare professionals, it's the responsibility of the community. We should engage the community. We should engage every stakeholder that they should come forward. This is our a national problem. We should like talk about this problem, and we should bring the solutions.
You're much right. And Dr. Kubra, coming to you, what is your message to our audience?
Okay, my message is that we should exclusively breastfeed our children. Being a mother of three, I can tell you how beneficial it is for you. It is not only beneficial. We think that if we breastfeed, we don't become beautiful and we become the fat and we have so many problems to our health. So this is not the scenario. It also helps and improves your health. It also enhances the beauty of your skin, and also after being a mother, who are the new mothers, they know that their hair become more thicker, beautiful, and they are look so beautiful. So being a mother is a so beautiful thing. So Allah has created us to nourish a new life. So this is our responsibility to be fulfill our duty, because in the Quran there is a direct like ayat. I don't remember the number of the ayat, but there is a ayat that we should feed our children till 2 years, and for the female for the 2.5 years, and also Allah has instructed the men that the mother who is feeding their children, you have to take care of her. If Allah has instructed us, then I think we should fulfill our duty.
Yeah, that's a very beautiful message, your audience. And as the world is marking World Breastfeeding Week this year, and with the theme that we need to just close the gaps, and there is a knowledge gap, but how we can fulfill that, we can raise more and more awarenesses. And there are more myths then there are more benefits, and even people keep on saying that there are some reasons that we need to avoid breastfeeding, but if you can avoid or you are avoiding that, then you will have some severe physical or hazardous circumstances that you're going to deal with in the future. And many experts, they keep on saying that breastfeeding helps a mother and a kid to avoid many diseases, whether they are chronic, whether they are communicable or even non-communicable. And formula milk, even right now, the scientists and the researchers, they have conducted many researches that the kids who are in their early ages are on the formula milk, they met diabetes and many other diseases in the future. Why? Because it's not an organic food. The organic food is only mother feed. So keep feeding your kids, keep feeding your young lots, and keep feeding your beautiful children, because they are the most beautiful thing in the whole world, and they have made your life more beautiful, and they have completed your family. With this, we are just thankful to Dr. Kubra Mehmood and even Dr. Aftab Ahmad for being with us and sharing their knowledge and insights on this important topic, and giving you all kind of information and awareness about that, how much important it is and what's the significance of breastfeeding. With this, we are just signing off. Allah Hafiz, fi amanillah, and stay blessed.